So one of the benefits that I think that we have, and this is taken from an advertisement that we put in a local paper for a focus they had on Alzheimer's disease, is that we'll say we're more than just a nursing home. Shalom Village is a community. We use the term nursing, although we call them long-term care facilities. You know, I think I was on an advocacy committee for OLTCA last week, and we were discussing the common vernacular people would use, and I think the average person probably knows what a nursing home is more than a long-term care facility. So we chose to use that in our ad that we placed. And so we're very fortunate to have a whole continuum of care, and I think this helps to shape the rehab and active living experience that our residents can have at Shalom Village. So just a little snapshot of what we do have. We do have our biggest program by far is long-term care with 109 residents. 15 residents are in convalescent care, so we actually have a grand total of 127 long-term care beds. We have a supportive housing program as well on site, which is 83 residents who live in 81 independent living apartments. We also have an adult day program, and within that adult day program, we have something called Goldies to Home, which is a unique 30-day outpatient rehab program where people can graduate, if you will, from our convalescent care program into that, just to get them back into home. And I mention these because they help to augment the physiotherapy resources that we have hanging around the building. And we also have something we call the Club Fitness Center, and we are a not-for-profit, so standalone charitable organization. So we have lots of different opportunities for active living at Shalom Village. We do have a very comprehensive physiotherapy program with a physiotherapist who we love dearly and has changed through different providers for us to stay with us over the course of the past year or so, and which I think is I've been really grateful for. We do have a nursing rehab program like all of you would have. Our community center, which is Shalom Village Code for recreation, has a number of different exercise programs, and of course our Club Fitness Center many residents are able to access them. Just a little bit about the Club Fitness Center. It's a fitness center open to the community as well for adults over the age of 70. Any Shalom Village resident is able to be a member of the club for no cost, added cost to them. There's a small monthly membership fee for adults in the community. It's about $18 a month. My accountant keeps telling me I need to make that higher, but I'm not so sure about that. In our club, we have 2 full-time staff members, and we fund this through an annual fundraiser that we have, the Hanukkah Hustle, and I'm going to talk a little bit about that at the end of my presentation. And you can see a picture there of the older gentleman in the hat. That's Jakob, and he looks forward to that event every year. It's in November, so we drag 100 frail residents out into the cold in November to do 1K and 5K walks down by the Hamilton waterfront. So, and in particular, looking at our long-term care residents, they're able to attend the club to receive one-to-one instruction and supervision, exercise classes, and also for those where the club is not a good social milieu for them, they can come and receive fitness programs right up in their home area. So like all of you, and I've heard some of the presenters talk about the change management process when we got the news that we were going to have to significantly change, cut, if you will, the amount of physiotherapy that our residents had. I think it was Krista who talked about just getting your teams together and spending hours together trying to figure this out. One of my team members has a favorite saying. It's called, "I'm stuck in a wet paper bag." And that's what we sort of all felt when we looked at our 103 residents who were getting physiotherapy to try and figure out, well, what were we going to say to them and to their families, and how would we explain this, and how do we look at the new definitions and the policy and all this sort of stuff. And it really just took all the smart people who work at Shalom Village sitting around the table together, indeed doing that, looking at each individual resident. What are they getting now? What could they do without? Where would be a better place for them given this new paradigm that we're working in? Some of the other detailed things we looked at, how would we admit people into physiotherapy, discharge them? How are people referred to our program options? Working with the PT vendor that we chose to continue to work with to revise our programs, and also an assessment and evaluation processes. And much of that work is still ongoing. I thought I'd just give you all a snapshot of what our amount of physiotherapy service in particular looks like now. So for 109 beds, we have 18 hours per week of PT and 35 of PTA. You can see the data there. So that translates into roughly 1 full-time equivalent PT. So our physiotherapist is there a little more than full-time each week. And this is because we get an extra 10 hours per week of physiotherapy through our Goldies to Home program. The benefit of that, too, is that she's in the building. So if we have an urgent need or something, she can sort of fly in and around. Basically, that's what she does, is she flies around our whole campus all day long, serving our residents. We did have a significant drop in PTAs, and prior to the funding model, we had 1.5 PT. Thought I'd show you some of the numbers of what the participation rates look like now on our active living opportunities. I have both numbers of residents and then just to give you an idea of percentages. So those who are in one-to-one physiotherapy is 63 residents, and so again, like many of you, almost all of our residents were receiving physiotherapy prior to the change. We're at 103 residents. I have not included convalescent care in this because all of them receive physiotherapy and services while they are at Shalom Village. For nursing restorative care, we currently only have 9 residents in that program. I'd like to see it a little bit higher. What I'm finding is we sort of have we're having trouble finding people who would qualify. We tend to have people who've maybe come in, they're quite physically well, but dementia is ravaging their brain, but they don't really qualify for the physical rehab types of nursing restorative care. And then we have people at the other end of the spectrum who are very frail and no longer meet the criteria for that in particular. For our community center exercise classes, we have 18 residents who attend, and there's actually a larger proportion who attend fitness, exercise programs in the club, and I think it's a very fun and appealing place for folks to go. There's residents from our apartments are there, people in the community are there, so it's a real community-based feel, particularly for those in long-term care, and so many of them love to get out of their usual environment and go down to the club on a daily basis. For both what we all know even for our own selves is it's as much about our social and emotional well-being as our physical well-being. I thought I'd just share a little snapshot of what our Physiotherapy Summit reporting looked like, so you can see the ins and outs. Again, we had the 103 residents who were there initially, 9 extra were admitted, and then we did have to discharge a number of residents from the program. In terms of the referral process, it's not a very scientific process at the moment. We assess people upon admission, significant change, quarterly, and upon request. It's really the physiotherapist with input from the multidisciplinary team does the bulk of that assessment. But again, it's not just using the tools, but also our own clinical judgment and knowledge of the residents of what are their goals for themselves. Again, not just for their physical rehab, but for their quality of life when they're living at Shalom Village. We are in particular working on objective outcome scales driven referral criteria for our nursing restorative care, so we become more specific around that particular program. One of the things that I wanted to mention earlier but didn't is we were worried about how residents and families would perceive this. How are they going to feel? What kind of meaning is that going to have for them when they're told they're no longer eligible for physiotherapy? I think a lot of us worried about that from a very human perspective, aside from all of the outcome scales and data and all that sort of stuff. And what we have found is that by being positive and focusing on this is what we do have. We have physio, we have exercise, we have the fitness club, and here's what we think is best for you. What do you think is best for you? And we've been able to really work through that very successfully with families and residents, so there isn't a feeling that they have lost something. I think that although those of us in the room, we know that the dollars show there has been care and time lost, that's not a burden that we want our residents and families to bear necessarily. Some of them will take that up in their own advocacy efforts, but for many, they just want to know that they're important and that they matter and that there is something there for them, and that's really what we have tried to focus on. I think we've done that very successfully. We have lots of continued challenges, like all of you. I think for our physiotherapist in particular, she really struggles with the clinical work that she wants to do and the documentation requirements, and we have not found a good balance for her or for ourselves yet. Ensuring all our residents get the opportunity to achieve their maximum potential and maintain their abilities. I mentioned that we're looking at trying to refine our nursing rehab admission and discharge criteria. I'm concerned about the work-life satisfaction of our physiotherapists and PTAs. There's been a significant change for them. Although I do not employ them directly, I wish I could, because then I could wrap them in. And I think some of the changes that they've had to endure in this change have not been fair and right from a moral perspective. And so I worry about that. And so I wonder, would I ever want to look at the effectiveness of a vendor versus myself as the provider for that? And of course, I think for all of us, looking at the impact of these changes on our resident outcome satisfaction, not only at our home level, but at the systems level. And I know that that is something that OLTCA is working towards. If this was the Shalom Village show, I would bring up the video that we did of our Hanukkah Hustle this year. It's a fabulous video that shows how fun active living is for seniors and generally. I made the video because I wanted to put a vision out there of how being frail and old can be fun and awesome, particularly if you live at Shalom Village, and can be part of our Hanukkah Hustle. And so I would encourage you to look at the video, share it with some friends. It's one of my favorite days and one of my proudest days as CEO when I stand in front of the group of residents lined up ready to go for walk and raise funds for our club. So thank you for listening.